What's up, everyone, and welcome back to another episode of Health Yes. Here at Cameron County Public Health, where we talk about all things public health and more. I'll be your host today, Javier Chavarria, and with me is my colleague Gualberto Garza. Joining us today is Mr. Moises Arjona from Unidos Contra la Diebetes. Today we'll be discussing not only the importance of managing diabetes, but men's health awareness and some of the challenges we face when it comes to taking care of our own bodies. Thanks for joining us. Now then, Mr. Moises, if you don't mind sharing with us, could you tell us a little bit about yourself, maybe even a little more details as to what you do with Onidos, and maybe even some challenges or experiences that you had with promoting men's health down here in the Valley?
Sure. Moises Arjona Jr., Collective Impact Director for Unidos Contra la Diebetes, and I'm coming from Weslaco. First of all, I'm a Valley native. I'm born and raised here in the Rio Grande Valley. I'm a 52-year-old male, and health is really important to me. Not only is it important for me, but I always spread the word. I'm a gastric sleeve patient. I was 400 pounds. I had blood pressure, diabetes, sleep apnea, you name it, I had it. And I made the change 15 years ago to live a better, healthier life.
Wow.
But not all of us are able to do that.
Right.
I had a great insurance plan, and I had some other factors that I needed to take care of. So for example, I was taking care of my father who had Parkinson's, and learning how to care for the elderly. I said, what if I have a stroke and I'm 400 pounds? Who's going to put a diaper on me?
Right.
Who's going to change me? Many of the houses here in the Rio Grande Valley don't have central air and heating. Our house did not have. We had window units. So seeing someone get bed sores because you don't have proper ventilation, you don't have the proper, education to rotate someone and stuff, it's really hard. So I was like, 400 pounds, I have stroke. Who's going to care for me? Who's going to do that for me?
And like looking at you, you wouldn't have never guessed that you were at that weight.
That's what people say, but it takes a lot of maintenance with that. So after 6 months, my acanthosis nigrans went away, which are the black markings around your neck and your cheek and groin areas that let you know that your body's insulin resistance. Those went away. My blood pressure I've kept it, but the sleep apnea went away. I stopped using the sleep apnea machine, changed my diet, and it's just led to a healthier life. Yeah,
I have an aunt who also had the gastric bypass as well. She was also a very heavier lady, but she started having some health complications as well, and that's mainly the reason why she had to get that done too.
Yeah, and when we talk about men's health, we're really looking at the male. Then the majority of them are the breadwinners, right?
Right.
And when you look at your family and you look at what's going on in the Rio Grande Valley and what's going on in your home, we as men only want to take care of the symptom.
Right.
Why am I feeling this way? And then you go to the doctor and the doctor finds 20 other reasons why you're feeling this way. But for me, the breadwinner, I just need to go back to work.
Right.
So how can I get back there? And that's hard for us because, as we all know in healthcare, now we have a holistic approach.
Right.
It's like, find the root cause of the problem.
Yeah.
But I'm like, I don't have the energy or the time for that.
And that's one of the things that we're trying to get across to people with our upcoming events promoting men's health is the importance of not only knowing the signs, but also like doing something about it the moment we start seeing it.
When I was 44, 45, I also started having prostate issues.
Right. And
that's an issue for a lot of us. We don't want to go to the doctor and have the exam.
Yeah, everyone thinks it's embarrassing, right?
Yeah. And no one knows the struggle that you go through getting up 13, 14 times a night, or, I'm being exaggerating there, usually 4 or 5 times. And you try to go to urinate and you can't, and then you go back to bed and you go back up. Finally, I didn't want to go to the doctor, but I got a prostatitis. I couldn't walk. And it hurt to just walk. And finally, I had to give in. And I went in and my prostate was elevated. It was swollen. It was enlarged. And I had to take medication for it. Guess what? After the infection went away and I got on the medication, I have no more problems. I actually sleep through the entire night.
That's good.
But a lot of men don't want to go get tested.
I mean, in speaking of like taking so long to go and get yourself tested, my brother, he doesn't like talking about the story and everything, but my brother used to have Hodgkin's lymphoma. He started getting a mass here, and we were worried that it was going to be cancerous, and it was, and it took him forever to we had to push him and everything to go and get himself checked out. And like he tried hiding it with his beard and everything. He started growing a mass, and we're like, bro, come on, we got to do something about that.
Yes, you can't hide it, right?
No.
And we're taught that we don't talk about it, and even amongst men, we don't talk about it.
No.
So my dad had Parkinson's, Alzheimer's, and then would I go talk to my mom, like, hey mom, this is happening to me. We don't have that role model to say, and we're not raised to say, hey, go talk to Wally and ask him, hey Wally, hey, this is what's going on, because that's kind of like intimidating already. We don't talk about that. There's a bro code. Yeah.
There's always that bro code that be a man.
Yeah.
Fight through it, push through it. It's that no pasa nada.
Yeah. No
that
pasa
mentality.
nada. That mentality is not best for us. So yeah, prostate blue tie event. I'm glad that Cameron County is doing this. You all did it last year. This is your second one coming up, right?
This is I want to say this is our 5th annual.
Or your 5th annual.
This is the 5th one that we've done. It's gone through a few name changes, but primarily it has been a men's health awareness fair. It started off with the first times around we did it at Bass Pro Shop, but now we're having it at Lansing Hill Park in Harlingen, and that's going to be this coming June on the 9th. And we want, the message that we've always tried to provide for that is to get yourself checked, prostate exams, and all the screenings that we have available there, glucose screenings and what have you. So really the whole event is just to promote awareness and to, it's hard to get a man to go and get themselves checked. So we try to do things to attract men to go in there, music, food, or what have you.
Because we need it all, and we do need all sorts of motivation to get us there.
We don't like admitting it, but yeah,
it's true. And the one thing that I think is key about this event is that you all do it in the evening too.
Yes.
Because a lot of us get off of work and we're able to come into something with our family. So you make it a whole family event. It's
we're trying to make it as convenient as possible for people to get there.
Yeah, so that's cool.
Wally?
Personally, I've had a story where, I would talk to my dad, and like, I know for him it was hard to admit like what was going on with his health. It happened years ago where I know I was in high school. At the time, I was just living life, like playing sports, and you really don't think about it when you're a young man, right? But then I remember having this conversation with my dad, and he would tell me like how he felt. He felt very tired. He felt like he would always crave a bunch of food. He really didn't know what was going on with his health at the time. And for some reason, he had this thing where he would sweat excessively. And it was weird because we would be indoors. There's air conditioned, like literally 68 degrees, fresh. And he was just sweating. He was sweating and sweating. I couldn't wrap around the fact that this was happening a lot. So I remember one day I told him, have you gone checked? Have you gone to the doctor? And he said, well, you know what? Today's my day off. I want to relax. I really don't want to do anything, as it is. Your mother is bugging me to go to H-E-B and go buy groceries, but I want to relax, maybe I'll have a beer. I'm like, okay. And then sure enough, this happened again. The following week, I think the sweats got worse. So I finally told him, okay, like, you seriously go to the doctor, I mean, I don't want to say it's like life or death right now, but I don't know what's going on.
Yeah, as men, we're raised to be breadwinners. We're raised to be, providers, and to not let things get in the way of doing that. Yeah. So, we try to get back to work as soon as possible, and sometimes we ignore these important signs. We, as much as we want to provide for our families, we also got to make sure that if we want to provide to our families, we have to stick around.
We have to stick around.
Oh, for sure.
Health is key. So what was the outcome with your dad?
So essentially, the outcome was that he went to the doctor. He was diagnosed with type 2 diabetes. He had high blood pressure, which kind of, led up to the excessive sweating. And obviously, he did need to make some lifestyle changes. Less alcohol consumption, less greasy foods. Another thing, they told him that he had fatty liver. I know that's very popular, especially among Hispanic men. Right. So, like even me, I'm 27 years old. I try to live a balanced lifestyle. Every now and then, of course, along with my family, we go to Whataburger, after church, something like that. Or after a social event, after a quinceañera, we all want to go eat some pancakes at IHOP or get Whataburger.
Yourself, but like,
exactly.
moderation,
Of course. And that's what it comes down to at the end of the day.
Yeah. And, we follow our friends on social media and one of the things that we're learning here in the Rio Grande Valley, and I'm sure you all see this too, is we're getting younger and younger with diseases. Men are being diagnosed younger and younger. So there's a young man that I follow on Facebook, real athletic, all gung-ho, excited, 30 years old, colon cancer.
Yeah.
We don't get screened till we're 50 for colon cancer. Mm-hmm. So when I went and got screened, I was like, yeah, just go ahead and just do the whole colon cleansing, make me 50 pounds lighter. I'm happy. It's good. And came back. Everything was good. Thank God. But I'm 50. This guy is 30 years old, has 2-year-old children and barely starting his life. Mm-hmm. You know what I mean? So those are types of things that we need to also talk about at the forefront and make sure that we all get screened when we have to. And I was talking to someone yesterday, a coworker, a colleague, former colleague, and we were talking about we need to move that screening ages to younger.
Yes,
I agree with you. Yep.
Yeah. There's this stigma of like when you're young, you don't want to be doing those things.
Right.
So, but we do have to normalize that it's okay to get yourself tested at a younger age, and that these services are available at a younger age.
Right.
They're recommended, or they have been recommended at the older ages, but I think it should be open for everyone else to get younger ages to get checked, even just as a regular routine checkup.
Yep. Completely agree. We especially for those of us that work in public health, we look at what services are available out there. I think sometimes the hidden gems, like for the county health department, we don't all know what they are. The only thing that we associate the health department with are WIC and vaccines.
Yeah.
But there's so much more going on here. And I think sometimes we just don't know what is available to us. And I think that's why I like what y'all are doing with the Blue Type, and also you're bringing all this other to the forefront.
Yeah, we're trying to bring to light the services that people don't know about. So when any opportunity that we can to bring to light to the public these services that we have available, we're gonna take advantage of it, and that's another reason for this podcast as well.
Yeah. The services now that we all have available to us, with the federally qualified health clinics, your FQHCs, and I think in Cameron you all have Su Clinica in Cameron County, Willacy, in Harlingen, and in Bronzeville, and then you have Bronzeville Community Rehabilitation Center. Those are all great resources for people to go ahead and go get checked and make time for it. And then I'm sure there's other resources out there that you all refer people to as well that can go and get checked when they need to.
And talking about services available to the community, what does Unidos Contra la Diebetes provide for men and the community in general?
Sure. So great question. Unidos Contra la Diebetes is a collective impact initiative. So what we do is we bring our organizations together to work in a structured way to bring awareness to health and prevention. So when we do get calls for someone that says, hey, I'm a controlled diabetic, I need help buying medication, first of all, we find out where they're from and then refer them to the nearest safety net clinic. And then they're like, oh, okay, I have it. I'm not a patient of that clinic. I'm a patient here. Well, okay, let's try to get you the services that you need. So it's always about who in the community can we refer them to? Because we don't provide direct services, but we are able to be that connection for the community to the right partner.
What can you tell us a little bit more about the importance of early screens? I know we've already kind of talked a little bit about it in conversation, but is there anything else that you want to tell us a little bit more?
No, the one thing I tell everyone, and I learned this the hard way, if there's a health fair or a health event going on in your community, take advantage of it. It's free. They're doing screenings for free. So even if you have insurance, go to a health fair, get the screening done. But let's talk a little bit about what health insurance is for us and what it isn't sometimes for us. But if you have health insurance and you don't use it, hit yourself on the back of your hand, man. That's not good. Go to the doctor. Your organization is paying the majority of the heavy lifting on that insurance. If you're part of the Affordable Care Act, you're paying for it. Go and get checked. Find a PCP. Find a primary care physician. Go quarterly. Go to those follow-ups. Tell your physician, don't schedule me so early. Schedule me in the last patient that I can be. I'm work. I do this. They'll work with you. Don't wait till the last minute to where you're sick and you have 30 symptoms coming up. Get checked quarterly if possible, and stop at every health event. They're free. Nothing's going to hurt you to get in there and sign your name and get checked.
I mean, you're already technically paying for it if you have the services provided with your insurance. Why not?
Exactly.
And we're to make the analogy like here is like when your car you see the dashboard start lighting up. Last thing you want to do is ignore that and have your car bust down in the middle of the highway or something.
Right.
The moment you see those flashing lights, those warning signs, get checked.
As soon as we see the warning light,
we
feel it, we stop, right? We stop, put the car, make sure my family's, because that's the car for the family. We need to take care of it. We go to the nearest mechanic, we fix it and take care of it. Do the same with us.
Even if it's not like the lights, if you just start hearing the little noise, you hear the little noise, you roll down the window. Yeah. You're like, okay, what is it? I forgot what it is.
Our car needs fuel, right? Yeah. So we fill it up once a week, twice a week, three times a month. Maybe you're lucky, right? But that's the same thing with us. Our body's giving us our little check engine light. Your gas is running low on something. Go get it checked.
We have a very important engine that we got to keep running.
Exactly.
And we got to do everything in our power to keep doing that.
Exactly. We love our loved ones and we love what we do and we need to take care of them. What I learned when I went to become when I went to do my bariatric surgery, what I learned was that not everybody was honest with me.
No.
So I want everybody to be honest with me. Every morning I take a handful of vitamins. I had to take 3 protein shakes or 2 protein shakes. I have to do all this stuff. It's not easy.
It's maintenance.
It's maintenance. Yeah. It's maintenance. But the people I talked to didn't tell me all that. Mm-hmm. And then your hair starts falling out. You're having other issues and all this kind of stuff. And you need to be honest with ourselves and talk to people and ask people, hey, be honest with me. Mm-hmm. The most important thing was that I had to have a tummy tuck. I had all that skin left over. Mm-hmm. It was, and if you don't have $10,000-$15,000 to do that, you're not gonna be a happy person. Let me tell you. So you start scrounging, looking for money, see if you can do it, take out jobs.
And to bring it back to the story that I was talking about with my brother. I mean, it took him a while. He even after he got diagnosed, he still wanted to keep living the life that he had. Yeah. But after chemotherapies and stuff, like he had to learn to change his lifestyle, not only for the treatments that he was getting, but also because his body was changing afterwards.
His body changed, yeah.
And unfortunately, he came out the other side pretty well.
Good.
He's what's the term?
Remission.
Remission. Yeah, he's in remission.
That's great.
But in the span of my brother's diagnosis and my brother's chemotherapies, my dad was stressing a lot. Because I mean, up until before we didn't have where my dad worked. He was the main breadwinner of the house. Where he was working at, they didn't have insurances to cover that, and it just so happened that I guess by the graces of God or what have you, we was fortunate enough that he had started working for PUB. They insurances, everything's provided right from the get-go. Vámonos. We have it good to go. Health insurance, cover it. Great. Cover mijo, everything.
Yeah, that's great.
And then in the span of all that happening, my dad started stressing out.
Yeah.
And then he developed the cyst, almost in the exact spot where my brother started getting his as well. Wow. And then we were telling him, hey, brother's having this happening. Get yourself checked as soon as you can. Yeah. I know your priority right now is taking care of him. Yeah. You also need to get yourself checked.
Yeah, it's we don't realize it, but stress plays a big role in their lives.
And that's what the doctor told him. The doctor told him this cyst is being caused by stress. Yeah. And luckily enough, it wasn't anything. It was just a cyst that he had. And he had it removed. He had to have my brother and my dad basically have the same scars. Wow. Where they both had to have skin removed and then taking that off. And then
we've been doing blogs. We do blogs, a blog every month, and we do some video blogs as well. And I don't know if you're familiar with Dr. Maria Dilf out of Harlingen.
No,
she actually works at Rio Grande State Surgical Center, surgery center, or State Center, not surgery center, State Center. And during her interview process with her, she mentioned one thing that happened to her. As a physician, she knew that she knew the signs of prediabetes and diabetes. She became diabetic. When she became diabetic, full-blown diabetic, that's when she reassessed her life. Mm-hmm. And guess what I've done? I've reassessed my life. So now when my body says wake up, I wake up.
Yeah.
When my body says go to sleep, I go to sleep.
Yeah.
And when my body says eat, I eat. It's hard because sometimes you might not be hungry at noon. You might be hungry a little bit earlier. And maybe sometimes the alarm goes off at 8 and you don't want to get off of bed. I'm at a pretty good luxury job where I can sleep in an extra 10 minutes or whatever, right? But you have to listen to your body, and I've begun to do that because I was working like 7 to 7 every day, and it was killing me really, like because I need to make my goals. I need to make this.
I had a similar experience when we were during the pandemic, when we were all kind of cooped up in here dealing with everything. We were essentially working 12-hour shifts, and like on the drive home, I would feel it, like my body, the fatigue, and then also I started developing an eye twitch, and I knew right then and there, I'm stressing out. I need to calm down. I need to take care of this. And I mean, I'm fine now, but our body gives us these signs.
Yeah, your body was signaling you, hey,
Yeah.
slow down, take it easy. And it's hard because we know this, but you have to sometimes relate. So hopefully this podcast, someone's listening to will listen to it and they'll be like, hey, you know what? From anything that I learned today, I'm going to go get screened and listen to my body.
Of course, absolutely. And what a beautiful note to end our podcast in. Guys, if you're out there, don't be shy about getting yourselves checked. Listen to your body. Take care of yourselves. Make sure you're there for as long as possible. You want to keep providing for your families. Don't just do it for them, do it for yourself as well. Don't be afraid to get checked. And thank you to all our listeners for tuning in to another episode of Health Yes. Make sure to follow us on Facebook and Spotify, subscribe to our YouTube channel, and we'll see you guys in the next one. Remember, stay safe, stay healthy. Until next time.